The most fulfilling part about being a rural resident is finally being able to actually do what drew me to OB-GYN, which is seeing people in clinic while also managing patients on the labor floor and then going to the OR certain days of the week as well. So being at a smaller hospital when you're the only resident and kind of seeing multiple aspects of that at the same time, you're really able to establish that connection and relationship with the patient before you're seeing them in a really vulnerable and scary and exciting time of their life, which is, really special to be a part of. So as a resident at Western Wisconsin Health in Baldwin, I generally start my day around 5 a.m. In general, I like to try to get some exercise before, either clinic or coming to the labor floor. Wakes me up and makes me feel kind of rejuvenated before the day. 7 a.m. I get to the hospital and round on patients or am prepping patients for the operating room or getting ready for clinic. And then in general, clinic starts anywhere from 8 to 9 o'clock. And we have full morning clinic, lunchtime around noon, where then I'll come back over to labor and delivery if there's anybody to see to make sure that everybody's doing okay. And then go back to clinic for the afternoon, normally until between 4 and 6 o'clock. Some of my favorite aspects of a rural OB-GYN practice are the increased continuity of care that you get by being able to see patients more regularly and being able to take care of them kind of more immediately. For example, seeing an OB patient in clinic and then being able to be their delivering provider is not always something that you get to do at larger institutions, but when you're in a more rural setting, then you definitely get to do that. A couple main differences between our rotations back in Madison versus at these rural hospitals are kind of the structure of our day. So typically in Madison, you're either on a day block or a night block, so you're getting sign out at 6 a.m. and signing out your patients at 6 p.m. So you kind of leave all of everything at the hospital when you go home. Whereas when you're at the rural sites, you are constantly on call because there's one or maybe two doctors that are here, so we're always available if the ER needs us, if there's a laboring patient. In Madison, we're doing one thing every day for 3 to 4 weeks at a time. We rarely do what we do at these rural sites, which is have full clinic days and get to know the patients in the clinic setting before you see them in the labor and delivery setting, or in terms of like gynecology patients too. We see consults here in the clinic that, within a couple days we're able to get them into the operating room if needed. So in terms of our surgical experience on a rural rotation, it really depends on the week. We do get a lot of hands-on experience, so as residents, we're always, the primary surgeon with the attending, assisting, and helping as needed. And that just kind of depends on the amount that we're comfortable with and how many times that we've done that specific procedure or operation. I do think that the rural rotations prepare us well for practice, and always being a resident, you're kind of pushing your boundaries in order to learn as much as you can in a short amount of time, and it's really helpful because we get a lot more hands-on experiences kind of earlier on in our training at the smaller rural sites. Typically, you have less learners around you, so really if there's any interesting cases or people need help with anything, they know that I'm here, so they call me, and you're the only one, so you really just get to do it all. Definitely one of the best things about being an OB-GYN resident is being able to do deliveries. My general role as a resident at the rural site is being able to manage labor and do inductions of labor and talk to my attending staff about those patients as needed, and then just be there throughout the process. And then myself and my attending provider will be present at the delivery. I really, really love being able to meet patients in clinic and then be present at their deliveries. At these rural sites, we are able to do that, which is, I think, one of the main reasons that people just pursue medicine in general, is to establish those, relationships with their patients. So to really be able to do that is really special.